Blessings. This is Oracle, welcoming you into the Three Treasure Tea Talk today. Enjoy this podcast brought to you by Nico and Friends.
All right. Welcome, Dr. Snow, to the Three Treasures Tea Talk. Really glad to have you on the pod today. Welcome.
So I'm a licensed acupuncturist in California since 2013. I went to Yosan University in Los Angeles and earned my master's degree in 2013. Then I went on to get my doctorate at Pacific College of Oriental Medicine, which is now Pacific College of Health and Sciences, and went to China in 2018. Began working with another I guess Chinese acupuncturist who's also licensed psychologist, and he developed a system of classifying different syndromes according to Chinese medicine that I think is a very insightful way of dealing with mental emotional health. He describes certain properties of mental emotional health, and describes imbalances of those properties or those features of a properly functioning mental health, and describes those imbalances as different syndromes, similar to how in Chinese medicine we use syndromes to describe different disease states. So I would say that the way that Western medicine approaches health and the way that Chinese medicine approaches health are very distinct, and it might not be as clear to folks who aren't as familiar with Chinese medicine that that's the case. So allow me to maybe offer a few insights. The syndrome can often be divided into different categories, so that way we can kind of break it down bit by bit. There's often excess conditions and there's deficiency conditions. There's conditions that are typified by extreme cold or maybe extreme heat. And likewise, there's conditions which are more external or acute. In other words, they happen very quickly and suddenly, versus conditions that take a long time to develop, which are more internal. And so these distinctions I think can be the term for this is probably the 8 differential diagnosis. In Chinese medicine, we also add the yin and yang, which can be kind of a tiebreaker in some cases to sort of show that, okay, this condition is more yang than it is yin. And so when we think about heat, when we think about externality, and when we think about excess, those are all yang phases of disease. And when we think about deficiency or internality, and also cold, those tend to be more yin. So we can classify the disease as either more yin or more yang in that way too. So that's where we get the 4 different differential diagnosis, or the 8 different differential diagnosis. And those ways of looking at disease are pretty basic, but I think are a good starting point for understanding how Chinese medicine looks at a disease versus the way Western medicine would look at disease.
Yeah.
And I think the biggest difference is that Western medicine tends to sift through and find like the cell that is disturbed, or something like that, or there's a molecule that's floating on your body that we need to get rid of, or it's an imbalance or something like that. There's a pathogen that we've identified, so you need to take this antibiotic to get rid of it, etc.
Yeah.
Even with the DSM-5 and dealing with mental emotional disorders, they've broken it down very analytically to identify this thing is wrong with you and we're going to do this to fix it. And whereas I think with Chinese medicine, in order to determine that you have a syndrome, we ask a whole slew of questions to get a more of a synthetic approach to disease, and even use of the, I guess we could them holograms of the body, which are found in the pulse and also in the tongue. These holograms of the body, reveal what's going on internally, and can be used as a diagnostic in that way too. So, oftentimes these approaches to medicine can yield different results. And so, it's my understanding that as we delve deeper into, how acupuncture can be used to solve almost any health problem, we can use it also to help solve problems like addiction. But I think it's important that we identify what addiction is first before we attempt to solve it.
Absolutely. Yeah. Do you want to go into that right now? Like,
Of course. So, reaching back to this book, Transformation and Recovery, Bramboth, he identifies, that somebody who has addiction takes substances more than originally intended, fails in their attempts to cut back, spends a lot of time taking, getting, and recovering from the substance, is often intoxicated, can curtail or give up significant social activity because of their use, and their use, despite persistent psychological or social or physical consequences, they continue using, and they often need more and more to attain the same effect. So they develop quite a tolerance, and they suffer characteristic withdrawals and take the substance to relieve the withdrawal. So, when people are coming to me with wanting help with their impulse control, oftentimes they are not exhibiting any of those kinds of criteria.
right.
In which case, I could probably venture to say that I probably haven't dealt with a lot of addiction cases. So my experience as a clinician, I would feel probably a little bit out of my league without having also a team of folks who are involved in chemical dependency recovery, to also be working with.
Yeah.
And I would recommend that folks who want to get involved in this kind of medicine, that they start to work in that kind of field in any capacity that they can. And as they develop their skills, maybe they can begin to apply them in that setting. I myself have been able to utilize my skills in acupuncture in a setting that's a little unique, and I've enjoyed having that experience quite a bit, working with emergency response or emergency harm reduction crews at local festivals in California. One that's coming up where I think we met was at Lightning in a Bottle.
Yeah.
So that's one example. And Richard Gottlieb, he's a nurse practitioner, I believe. I believe that's his title. Could be wrong on that. He might be a registered nurse. I forget the difference. But anyway, the fact is that he runs a company called RGX Medical, and I've been volunteering with him for over 10 years, working at some of these festivals and events and helping people in these situations where maybe they've taken too much and they don't quite know how to deal. But in every case, whenever I work with somebody who's under the influence, I'm always very careful to make sure that we're able to communicate.
Yeah.
That they are cognizant and aware of what's going on, and that they're able to say no and say, and also give permission. So these kinds of things when working with a patient, it's very important that we follow this. And in cases where people are not able to communicate, I would say just wait and not offer them acupuncture in that situation, and until they're a little bit more easily manageable as a patient.
Yeah. So you actually do acupuncture when people are having these kind of like bad trips?
Sometimes, I mean, it's not intentional. Like, I wouldn't suggest that that's the case, but sometimes people will, not reveal it, and maybe until after the needles are already inserted. I don't necessarily think it's a bad thing as long as people are cognizant and aware of what's happening. Sometimes when people are experiencing what I would say unwanted side effects, maybe acupuncture needles can be helpful to restore balance.
Yeah.
In which case, if they're able to ask for help and they want it, there's no reason not to give it, just because they're under the influence. Acupuncture is a very safe, minimally invasive treatment, which, under the care of a licensed practitioner who understands the body and knows where not to needle, whereas it would cause, an injury. That's the only thing you really need to watch out for. And sometimes, patients, if they aren't able to be still during a treatment, they could be a danger to themselves. And so it might not be a good idea to needle them with a very deep needle, in which case there's other tools we have that are also effective and don't pose such a risk as a needle that's inserted more than a millimeter. We have tacks that come on little pieces of adhesive. I use them at night to treat myself. They're very effective in spite of the fact that they're very, very shallow.
Yeah.
And
Ear tacks are awesome. I don't utilize those enough.
you can use them anywhere on the body, and they're fairly effective, even though they barely puncture the skin. So
you use them on like your hands or your feet too?
yeah, you can use them anywhere on the body, just like you would an acupuncture needle. And they're quite effective. I'm a baby when it comes to needling. It's kind of funny because I tell people, probably one of the reasons why I'm so good with folks who have needle phobia is that I myself have a little bit of needle phobia.
Yeah. You don't get acupuncture very often.
Well, I needle myself whenever I need to, but I use the tacks, like I say. So
Yeah, that's not, I mean, that's so minimally invasive, at least.
they're very effective, so I don't have any problem with them.
That's wild. You know what? I've never used the tacks other than on ears. I've never seen it. Like I've seen and I would do clinics at the garden, people put seeds on P6, and I was like,
Mhm.
oh, I never thought about that. But
So
I really never thought about putting a tack on your arm.
needle. They're very similar to seeds, but they're actual needles, and they puncture the skin about a millimeter, or maybe even less than that.
And
So
you leave them in for like the night or
you can keep the site clean and dry. That's the only risk you have, is maybe infection. So if they do get dirty, then you would just need to wash that area with soap and water. You'd be fine. Treat it like a scratch.
have you ever used ASP needles?
I'm
Oh,
not as familiar with the term, no.
okay, yeah. It's it's a little bit more thicker, but they um do similar like ear tacks, but they're semi-permanent ear piercings.
Mhm.
I know folks use them for more intense treatment first for detox and also like appetite control or things like that, because you can stimulate them with a magnet because
Mhm.
they do stay in the ear for like maybe up to 2 weeks.
I think what you're talking about is battlefield acupuncture.
Yeah. So that battlefield acupuncture uses the ASP needles. But yeah, totally. And yeah, it was developed by the military, based off acupuncture. It's just like super kind of intense military style.
Yeah, I'm not a fan. Those things
Yeah. Yeah, because it's just too
are
much.
and I mean, honestly, if you have something that works just as well, it's not as intense as that, I would say go for that instead. But if you're out in the field and you don't have access to running water, maybe this is maybe that's better. I don't know. I found that even out in the field in the bivouac situation, you can safely use alcohol swabs to clean most areas, and it does not need to be any cleaner than that. So never had a problem with it in 10 years. Had lots of people very thankful for the effort that I make to bring this medicine out to the field. And so, I know acupuncture without borders also teaches people how to do what I do. And so that might be another way to be able to utilize this medicine in I guess, environments where folks who are experiencing symptoms of addiction might need help in that case. Now, to go back to like more along, chemical dependency treatment centers, if you were going to be working in that field, I think the biggest question is, how are you going to pay for it? if the patients themselves aren't paying for it, how do we get funding for this kind of thing? And one of the things that this book, the author recommends is talking to law enforcement. Seems to be an incentive for law enforcement to fund acupuncture programs, and the reason is because it actually reduces recidivism and the tendency for people to go back to doing what they were doing before, which can cause more crime. So it ends up making their job easier if they can help these people lead more productive lives. So it's my understanding that when folks who are experiencing withdrawal symptoms, which are daily, it's a daily thing, they have the best results when they have access to daily acupuncture.
Yeah.
So this can become very hard to provide to people who aren't in a treatment center where they're monitored daily and have access to care daily. Being an outpatient, this might be something that might not work for a lot of patients because being an outpatient provides them too much risk to begin using again. And so, having daily access to acupuncture in an inpatient facility that's funded by law enforcement might be the way to go. And I'm surprised I haven't seen more of this in my last 10 years since, this seems like a really good idea. But who knows? I'm not as involved in this field as some of my peers, and so I don't have all the inside scoops on what the barriers are to care in this particular case. But that seems to me like it'd be a really great idea. And so folks are good at grant writing, and they're good, and they have maybe connections in their local law enforcement. That's where I would look to get funding for a project like this.
Yeah. What is your what are you most passionate about in your acupuncture practice? Like what is your specialty or something?
I have specialties that basically are based on my own experience with this medicine and how it helped me the most.
Yeah.
There's 3 areas where I've needed help with my own health, and one of those is in dealing with chronic pain. I'm had several car accidents and snowboarding accidents throughout the years, and one in particular about 25 years ago, which it's taken a long time to heal because for the first few years after my injury, I didn't get that great of care. And so that's one of the things that led me to acupuncture, and in order to heal this pain that I had. And I found that after treating myself and doing daily exercises, stretching, I do what I would call Chinese medicine physical therapy. And I call it Daoyin yoga. And this is one of the things that I teach on a daily basis to a number of students. I have a studio downtown that I work with, Attitude Fitness at the Intercontinental Hotel. It's a 5-star hotel in downtown Los Angeles, right on Wilshire, near between Wilshire and 7th, next to the 110 freeway. And I go there every morning and teach for a couple hours, teach Tai Chi, teach yoga. And I would say that this has probably been the number one thing that's helped me with my own health the most. As definitely that and acupuncture and massage therapy have all really helped me rehabilitate my body from my injuries. And so that's one thing that I think I would say that I specialize in, and definitely can help a lot of people. But in addition to that, and which I think is also very important and wouldn't want to overlook, is that Chinese medicine has helped a lot with my metabolic health. There's a thing called leaky gut, which many people probably have heard about and have suffered from in various different guises. Anything from IBS to Crohn's to even things like autoimmune disorders like lupus and a number of different things. Even I guess SIBO is another way that Western medicine relates to leaky gut and the symptoms of it. So what essentially is happening is that with the use of antibiotics and the standard American diet, I think many many people have developed some chronic metabolic disorders based on this kind of diet that has reduced their microbiome population in their gut to basically nil. Imagine, use the rainforest analogy. The clear cutting of the rainforest is kind of what's going on with your gut whenever you use antibiotics, whenever you overuse alcohol, even sometimes when you overuse sugar. So some of these things can develop overgrowths of other kinds of bacteria and yeast or fungus, which then can cause the symptoms of autoimmune disorders, anything from eczema, psoriasis. A lot of different skin disorders can show up this way, even acne. So all this can be related to leaky gut syndrome. And oftentimes what Western medicine wants to do to help treat it is to give you more antibiotics, which, sorts of kind of vicious cycle. What I found is that actually using Chinese medicine, Chinese herbs act a little bit less harshly on the gut biome in some cases. Some cases they work just as harshly. So, but using things like herbs treated with bovine gallbladder juice, for instance, this kind of thing might not be the favorite among vegans, but I would imagine that it's very helpful for folks who want to clear out some of the gunk that's in their metabolism and get things running smoothly, and help the gut biome to replenish itself. Some of this stuff responds very well to additional bile, but also using probiotic foods, fermented foods, and cellulose fiber, which can help to feed these probiotics, can often make a big difference in restoring and replenishing gut health. And Chinese herbs have also been very helpful to help to balance and harmonize what's going on internally to deal with these sort of symptoms as well as you're trying to rebuild the gut biome into a healthier metabolism. So I guess that's probably another specialty that I should probably let people know that this is something that Chinese medicine can really help with. All these sort of Western concepts of metabolic disorder can benefit greatly from acupuncture and herbs, as well as using exercise as a means toward that end as well. And then finally, I think we touched on this a little bit already. I'm mentoring with one of my instructors from Yosan, Dr. Yang. He's developed this Shen diagnostic criteria, which is very similar to DSM, but I would say it's a lot simpler. And it's based on the same kind of yin-yang principles of the classics. We identify whether a syndrome is Kuang or Dian, which Kuang is almost like a mania, and Dian is more subdued, almost like depression. And so we would differentiate disorders that way. And so it could be both. It could be a little bit of both in some cases. In which case, we would identify it as partially Kuang, partially Dian, more Kuang and more Dian. And then we would differentiate it further into 14 different categories of Shen disharmony. Some of the Shen disharmonies are more of an excess case, and some of them are more of a deficiency case. But in each case, we would identify the syndromes similar to how we identify syndromes that would affect different organs in Chinese medicine.
Right.
So, for instance,
are these patients that you're seeing, I imagine they might have mental health diagnoses, and I wonder if they also take medications for these mental health conditions while they're being treated, or I was curious if, because it sounds like this this professor, Dr. Yang, kind of might specialize in mental health.
Yeah, and that's a specialty I've taken on as well too. I think that the use of these different syndromes to identify patterns is one way that treatment can be identified as being beneficial. And there's different herbs that do different treatment principles. So once we identify a diagnostic, or a diagnosis, then that will more or less dictate treatment principles, which will be useful to balance or rectify the disharmony. In that way, we identify which points will align with that treatment principle, which herbs will align with that treatment principle. So, the diagnostics dictate the treatment principles, and then we go from there to identify different acupuncture points or herbs. And even when we find the acupuncture points, we still want to identify what are we going to do with the qi when we get it. We're going to gather the qi, we're going to disperse it, or we're going to move it in a certain direction. So these are very important points as well. And it really does depend on the situation and different presentations. So for instance, let's take a syndrome that's maybe really easy to identify. Shen Qi cloudiness, for instance. Out of the 14, this is one that I think is probably really easy for people to relate to. When the Shen, or the mental Qi, mental awareness, is clouded, oftentimes people will be unable to think clearly. And you may have even described a situation where your mental awareness has been feeling cloudy. This is something that can happen when you begin to suffer from symptoms of a cold and flu, and there's phlegm in the sinuses. This can affect your awareness and cause you to have sort of cloudy thinking. It can interfere with clear-headed thinking, which I guess would be the opposite of cloudy thinking. So you can kind of see how these syndromes, in identifying them, maybe it doesn't necessarily identify something like depression, but you can see how something like depression might have a symptom of cloudy-headedness.
Right. And that would be of a Dian more.
It could show up as either. So a Dian syndrome could show up with cloudy-headedness, and so could a Kuang syndrome, with cloudy-headedness. It really depends on what's going on. If someone is having more yang state or more of a yin state, that will certainly affect. And whether it's affecting the liver, or whether it's affecting the heart, or maybe it's affecting the small intestine or something else, that will also dictate in some cases how this manifests. So we maintain that in each case there are different principles at work, and that's what we're trying to identify in order to treat effectively. So
Yeah, no,
I think
I'm really glad that we can really synthesize all of TCM, which I mean, I can tell you talk to patients a lot, because as viewers that aren't familiar with acupuncture, like, this is really valuable information for them, just even to know that acupuncture treats more than just pain, which I think is a common misconception. And as you stated, it can treat everything essentially, and it's the way they view the body, and using the eight principles.
differential diagnosis, is really key. And I think that once you understand some of the basic principles that you're dealing with, then you can treat effectively. You just balance things out, move the other direction. And
and I wanted to ask on that note about, right now we're in springtime, and so there's a whole chi of the season. And what do you tend to see, since we are kind of in the realm of like mental health, obviously mental health fluctuates for everyone, and what's kind of like the temperature right now as spring is just emerging?
well, you might think that spring's a little early this year, but that's because of the leap year. The spring equinox is this evening around midnight. And I think when the days start getting longer, the nights start getting shorter, people come out of their shells a little bit. So it's definitely a period of warming up and awakening. This is happening all throughout nature. We're getting ready for a super bloom, I think, here in Los Angeles. We've had a lot of rain these last few weeks, and so I think that that's one of the things that just happens with nature as the generative cycle works its way through the seasons. That's one of the reasons why I think Chinese medicine works, is because people who were really observant of these cycles that happen in nature started to notice that, hey, there's cycles in me too. And the cycles tend to go in the same way. So, finding this harmony with nature, I think, is how we can prolong life. And so connection with nature, I think, is extremely vital. So I'm glad you brought this up. It's definitely something that I think is overlooked in how we treat mental health. That connection with nature is probably the strongest way to improve mental health, as well as doing exercise. So get out there and hike. This is getting really good hiking weather. Be careful if there's been a recent rain in your area. Watch out for mudslides in that case. So, be careful out there. Go with a buddy. Always pack some water and be prepared for anything. But yeah, definitely get out there. And I think that this kind of weather, this kind of change of seasons is encouraging that. So I hope people do that for their mental health.
Mm-hmm. Yeah, well, thank you so much, Dr. Snow, for chatting today. And I would love to have you back on again, because we can, delve into different subjects. I think I really like the way you're very friendly to newcomers. Because I think in some of the other talks, we're getting super heady and talking about the 5 spirits, and I need to do some separate videos just to explain. And so I kind of slow down in a bit, kind of, because I think people are like, whoa, what? So it's okay, yes, you're interested, but let's now learn together. And so this talk, I think, is inviting that in, and I want to provide more resources for people to, just learn more about the principles. And it's obviously so much to have a whole different worldview, and it takes time to integrate. So it's pretty exciting, yeah, to share that with people that have no idea and open that up for them.
If that's something that you're interested in, maybe it would be worthwhile to go a little deeper into the 14 different kinds of disharmony that the Shen Qi can experience.
Totally. Yes.
And just to recap for today, we talked about the 8 differential diagnosis, which has yin and yang, hot versus cold, interior versus exterior, excess versus deficiency. Those 8 categories are very useful, and they can be used in any situation to identify the nature of the disease. And likewise, when we do that, we start to identify whether a mental health disorder is it more Kuang, is it more manic, or is it more Dian? Is it more kind of just depressed, or more yin, I guess, is probably another way of looking at it. And then, to what degree is it more yin or more yang? And I think that's probably the way to look at activity. Kuang can be thought of as yang in that case. And that might be a simple way to kind of identify those 2 foreign words. But then also to identify what is qi, what is shen, and then furthermore, what is jing. So if we think about qi and the vital energy of the body and the various different organs, we can think of something a little bit more physical, which we could identify as essence, or jing, which might be related to the body's hormones that it produces. These are physical substances, right? And then think about going the other direction, where qi is kind of in the middle. It's partially physical, maybe it's partially energetic, but then Shen is way more refined. And I think of Peter Ouspensky, he talks about the problems of the world and identifying the different varying mental stuffs. He compares it to physical matter, which I think this might be a not so unique idea, that as physical matter becomes more and more rare and rarefied, it becomes more mental matter. And I think that that's the idea behind Shen, is that it's a rarefied form of qi. Qi is a rarefied form of jing. And so these sort of things have a continuum. And so when we think about Shen, we think about the qi being ordered and harmonious in the body, so that, such that the heart becomes a suitable abode for the Shen to rest.
Yes.
And I think that typifies how the Chinese perceive Shen within the framework of qi and Chinese medicine, so that it's really dependent upon the qi working rightly. And if the qi is disordered, then the Shen's probably going to be disordered.
Yeah, it's like it's obviously hard to say everything should be one way, but I thought about the Shen, like we want the Shen to be settled.
Mm-hmm.
Generally, that's a
Yeah.
settled Shen, that's the most refined you can get.
Right. And think of it as like when you're in perfect meditative state.
Mm.
Okay. When you've stilled and quieted the mind such that instead of it being like an ocean, it's more like a still pond, like with not a ripple in it at all. And it reflects completely what's being shown to it.
Mm-hmm.
Okay.
Yeah.
That's the state of the mind that is a perfectly balanced Shen. Right?
Yeah.
Now it's going to be like that. But when it's not like that, we can identify how it's not like that, and such that we can bring it back to that.
Right. That using these principles. And I love, the analogy of water, I think is really powerful and relatable. And the waves, chi and vibration and all that.
Yeah, because Shen is like a vibration. It's a way of seeing the world. Shen is revealed in the eyes. When we're able to have a conversation and look each other in the eye and have good eye contact, that's because the Shen is communicating.
Mm-hmm. Yeah, beautiful. Well, thank you again. I will we can wrap it for now, and in maybe a couple months we can do the breakdown of the 14. Yeah, would love. Yeah.
For that, definitely.
All right. Thank you, Dr. Snow. And thank you to our viewers as well.
Thank you for listening to today's Three Treasures Tea Talk.